Hello, my name is Monica. I'm going to be walking through how to give medications for insulin through a vial. This is not something that you'll typically see too often, but we wanted to let you see that this was an option that a provider may order or that the pharmacy may have in stock. So the first thing you're going to do is you are going to verify the order, check the MAR, and verify the doses of the medications that you will be giving for insulin. And then what you're going to do is you're going to do hand hygiene when you get into the patient's room, introduce yourself, verify name and date of birth for the patient, and then you're going to gather your supplies, which are going to include a insulin needle, and this is an insulin needle, what it will look like, okay? And when you flip it over, it'll have the bright orange tip. There are other small syringes that won't have that orange tip. You want to make sure that it is labeled insulin, okay? Because on this side, it'll show the units of insulin that you can draw up, okay? You're going to want to make sure that you have a needle for this particular syringe that is 5/8, which is your sub-Q needles, okay? So 25 gauge, 5/8, and this is what it looks like. Okay, and then you're going to want to make sure you have several alcohol swabs. Okay, first thing that you are going to do after you've done hand hygiene and you've introduced yourself is you're going to take your insulin syringe out of the packaging and you're going to apply the needle to the top. So I'm going to remove that, and then I'm going to open and go like this, okay? So then what we're going to do, so our order states that we need to give NPH and regular insulin, okay? And this is regular U100 units, okay? So this is your short-acting insulin, and this is your intermediate-acting insulin. This insulin here is cloudy, so in order to ensure that the mixture is all over inside of the vial, you're going to roll and agitate, okay, to make sure that it is all throughout the vial, okay? So then what you are going to do is you're going to clean the tops of both vials for 10 to 15 seconds. Okay. And we'll get another one. So for the order, we are going to say that the provider has ordered 3 units of NPH and 4 units of regular insulin. So 3 units of NPH and 4 units of regular. At this point, put on your gloves and we are going to draw back, pull back on your syringe to loosen it. And we're going to draw back for the NPH, again, which is your intermediate. So you do your intermediate first. So you're gonna go back to 4 units of insulin, and you're going to take your cap off, and you're going to just insert the air into that insulin. Then you will remove it, okay? And then we are doing our proper amount of units here, okay? And then you're going to insert air into this one, and then you are going to pull back the proper amount of units for your regular, okay? And then you will have to pull back the proper amount of units for the NPH. So before pulling them up, you'll have to make sure that you know exactly how many units of each and what that total is. So we had 4, and 3, and that equals 7 units. So we should have 7 units of insulin. Okay, and then we're going to go over to our patient who we've already verified, and we're going to clean the site. Okay, 10 to 15 seconds. And then we're going to let that dry. Once it is dry, you're going to stabilize the skin and 90-degree angle. Inject, hold for 10 seconds, and then remove.